Dr. Swati Varma, one of the mentors in StudyMEDIC. Hope your preparations for part 3 are going in full boom. So in continuation to our Back to Basics series, in this video, I'll be mainly emphasizing upon the module teaching and research. So as always, let's start with the quote, "Nothing is impossible. The word itself says, I am possible." So don't consider any task as a burden or any task as impossible for you guys. With full dedication and hard work, everything is possible. Now let's have a look on what type of tasks we can get in teaching. MDT, discharge letter and operation notes. Here is a list which has sometime or the other come in your exams. However, in teaching, actually, they can give any and every topic. On whichever topic, any guideline or any recent talk has come, I would like to all of you to emphasize, especially on the recent topics. The topics on which recently any guideline or any talk has come, please don't forget to just brush through that guideline, because there has been a trend that based on that particular topic, you can get a teaching station. So all these topics or any of these topics you can get in the teaching. So now let's first of all have a look on the general aspects of teaching. What is necessary for you guys to emphasize upon while you are attempting any teaching station? So first of all, you have to enter with a happy face, because here you are meeting your colleague. Okay, so you need to have a happy smile on your face. Another thing which is never to be forgotten is whatever props you are provided, or whatever instruments, whatever things are kept in front of you, and if you are in, if it is there on your table, it is necessary that you keep on handing them to your junior while you are teaching. You should demonstrate the procedure and at the same time give hands-on to the trainee also, so that is the role player, so that he or she can also make full use of that in such a way that will demonstrate a better impact. Then check for understanding. It's very important that you keep on asking, or in between, that am I making myself clear? Or in the beginning itself, you can ask that, please don't hesitate to ask any questions. Don't hesitate to interrupt me to ask any questions, things like that. Another very important thing is, some of us are in the habit of asking first and then elaborating. Please try to avoid that. Never ask those questions about which you haven't explained before. First, explain the things, then only ask questions, okay? The only question which you should ask is, why are you curious to know more about this topic? Or may I know the reason why you wish to learn more about this topic? Then you have to introduce yourself without saying the word doctor. Hello, I'm this and this, ST5 here. Can I check your name? Nice to meet you. How are you doing today? And immediately, the first step should be rule out bullying. Do you feel supported? Any concern? Then, if he or she says that, yes, I'm quite happy to work here, everyone is very friendly, that means you have ruled out any bullying. Bullying and undermining are also the hidden agendas which are demonstrable in teaching stations. Then you have to check the background knowledge, why he or she wants to learn about that topic. Background knowledge means you don't have to ask specific questions, but you have to ask what you know about, have you got any idea about, and very politely, vaguely you can throw an open question that, have you got any idea about this? Or have you ever dealt with any patient? Like this you can ask, and why she is or he is interested to learn more about that topic, and then set your agenda. Reassure that if at any point of time he or she doesn't understand you, she can or he can interrupt, feel free to stop. Then comes the station, the main crux, in which you will have to demonstrate your communication skills also and applied clinical knowledge also. So your communication should be, what communication aspect here? Here you will have to give chunks of knowledge. It shouldn't seem like a lecture. It shouldn't be very elaborate and big sentences. No. Keep the information, whatever information you are giving, in small chunks. Please don't worry that if I will give in very small chunks, I won't be able to finish the station. Actually, it's absolutely okay. Even if your applied clinical knowledge is not that strong, still you can pass this station. How? Only your way of delivering the topic should be perfect. means excellent. It should be like the role player in front of you should understand, should get whatever you are trying to say. At the same time, it shouldn't be boring. So in brief, you have to explain about the importance, indication, contraindication, the procedure, explain and emphasize the safety points. Safety points is very, very important. Okay, don't forget the safety points. Post-op care, keep encouraging. Also, another important communication aspect is try to involve the role player every 90 seconds in one way or the other. Okay, am I making yourself clear? Am I making myself clear to you? Or ask some small question, whatever you have already explained, just very small point-wise question to elaborate. Give feedback at last. Whenever you have finished the session, you think that I have explained enough. Then, how was the session? And also, at the same time, give feedback to the role player also. That yes, you are doing really well. I appreciate your effort. You are a good learner. Okay, so give feedback, take feedback, make learning action plan that whenever next we will encounter such a thing, we will call you, give handouts and web links or GTGs, nice strategy, talks, whatever information you have got related to that topic. Say that, yes, I will hand over this to you to know more about it and encourage to come back again. At last, say enjoy and have a lovely day. So now let's take a look at 3 tasks related to teaching, which has been asked in the recent past. So first task is, here you are an ST5 trainee. Very important, guys, to read the candidate instructions, okay? ST5 trainee asked to help a junior colleague, Dr. Emily Brown, an ST1 trainee. What? You are required to demonstrate how to prepare a PPT on early ovarian aging. Now, your role player is unfamiliar and needs guidance on structuring the presentation, including headings to cover, key points under each heading, and clinical relevance. So it is very important that you know, because early ovarian aging is such a vast topic, you can't keep on speaking about it and you have just got 10 minutes. So now it is very important that you read what are you required to do, what specifically you have to tell her. So structuring the presentation means you have to give an outline of what your PPT should consist. Explain key concepts and clinical relevance. You have to emphasize on the key points only, including epidemiology, diagnosis, and management. And encourage at the same time your role player to keep on asking questions and clarify. Okay, so your 2 main basic things are how she will or he will structure the PPT. And the next important thing, epidemiology, diagnosis, and management you have to emphasize on. So just keep yourself focused that these 2 things you have to cover in your teaching. Then you will be assessed on these 3 main domains. In teaching station, teaching skills might also come as a domain. In the 10 minutes, yes, these are the role player instructions. You can go through it later. Here, why I have kept these role player instructions here? So that you can get an idea of how your role player might be. Might be your role player is quite overwhelmed by the breadth of the topic and the knowledge, background knowledge, you never know. Maybe he or she already has an idea about the basics. Maybe he or she is absolutely wrong. Then some of these questions the role player can ask. If he or she doesn't get the proper answer from you, they may ask further. So you can go through these questions later. Now let's come on the domain-wise marking. Patient safety is always actually the most important domain. Must ensure that trainee understands the clinical significance of early ovarian aging and its implications. So it is important on what patient safety points you have to emphasize while you are explaining to the role player. You have to explain the importance of recognizing the signs so that you can initiate timely investigation and management. You have to emphasize on this point that early detection allows opportunities for fertility preservation as well as counseling. Next important safety point is you have to discuss the consequence of late diagnosis with the patient, including missed opportunities for fertility preservation and psychological distress. That's a very important safety point. Then other safety points are emphasizes the need for individualized management plans, avoiding unnecessary interventions, stress the importance of these non-invasive diagnostic tests like AMH and AFC. Okay, so non-invasive as much as you can so that patient's discomfort is also minimized and your diagnosis is also made. Then multidisciplinary team involvement is very, very important safety point. So fertility specialists, endocrinologists, mental health professionals, all have to be involved to provide comprehensive care. You have to emphasize this to your role player that it is important that you do this. Then comes applied clinical knowledge. In applied clinical knowledge, they will mainly test that how much in-depth knowledge you have got of early ovarian aging, its various aspects. You should know the definition of early ovarian aging. You should know the difference between early ovarian aging and how to differentiate it from POI. Okay. Pathophysiology should be, they don't expect you to be very exact, but in rough, pathophysiology should be clear in your mind. It's good if you have gone through it recently, you will be able to emphasize on it in a better manner, but a rough idea should be there. And then comes the clinical features. You should know about the features, how the patient will present, what diagnostic tools, what are the first line tests which you will go for, and then you should be aware of the management strategies which are offered. So all these you should be able to demonstrate to your role player, not in a very detailed manner, but yes, just the outlines. And then keep on applying the teaching skills in between. You should not speak it like a lecture. You have to interact with the role player in between. You have to encourage him to ask questions and you have to ask questions yourself. Suppose you tell about these diagnostic tools and then immediately you can ask that, okay, can you repeat? Okay, so like this, it will be interactive also and your applied clinical knowledge will also be demonstrated. Then comes communication with colleagues. Very, very important here in this teaching station. Communication with colleagues is tested in the best manner. So their key expectations from you will be that you engage the trainee in a two-way discussion. That is, encourage them to ask questions and clarify doubts. Create a supportive learning environment. You should never be rude. You should never be judgmental. Trainee should feel absolutely comfortable and express whatever is there in their minds freely to you. Then another important communication aspect is you should be structured. Okay. You should first tell about definition, then pathophysiology, then the clinical features, diagnosis. Means it should not be scattered. Your information shouldn't be scattered here and there. Like you are telling the management first, then you are going on to diagnosis, then you are going on to definition and pathophysiology. No, it shouldn't be scattered. Okay. It should be structured as much as you can. Then clear and concise communication is very necessary. The way of talking should be very clear. And if you are not confident of anything, avoid speaking about that. Okay. And at last, it is essential that you give and take feedback so that it can look like a cooperative discussion, mutually cooperative discussion. Then finally, there are global criteria, certain global criteria that overall how you have performed in the station. So these are the main things which they will take care of while they are marking you to give you overall marks, whether you are pass or fail in that particular station. Now let's come to the next task. Here again, you are meeting your ST1 who has joined today itself. She wishes to discuss the management of Para 1 at 36 weeks with Frank Breach. She wishes to learn how to counsel her about her options at this time. Now, you are expected in these 10 minutes to obtain relevant information and discuss the management options. Now, obtain relevant information means information gathering here is important. So, obtain relevant information. You have to obtain relevant information from the role player regarding the patient about the criteria for ECV and all those things. Then discuss the management options and last obviously will be answer any concerns or questions of the role player. So these are the role player instructions. Have a look. Then again, general aspects will apply everywhere. Then in this specific station, you have to tell the role player that ask the patient about her present pregnancy. How is she doing, her scans and investigations, so that you can know any risk factors which can contraindicate any particular modality. Then whether right now, is she feeling all right? Is she having any symptoms to which you will have to address firstly, and then go on to explain her about the options. Baby movements, very important to ask at this point of time. Obstetric history is very important here. Along with earlier, means past pregnancies, it is very important to know about the future fertility plans of the patient as well. Then comes medical history, surgery history, and all the general points. Then you have to tell your role player that how are you going to counsel the patient. So here you will explain to the patient like your baby is in bottom first position, and these babies are called breech babies. They are very, means like only 3 to 4 in every 100 babies are in the breech position. Not very common, but yes, most probably, if the patient wants to know, you can explain that why it happens. Most probably it's a matter of chance. Otherwise, these may predispose. Then come to management options. First option, which is provided to the patient, is to turn the baby in the uterus into the head first position. So here you have to demonstrate, you can say that you will provide the option of ECV, how he will explain to the patient, he or she, like this. Then the another option, if ECV is denied or is unsuccessful, then the patient is left with the options of vaginal breech birth and cesarean section. Then in brief, you have to tell the role player. Now, role player, it is very essential that it's a first day. She has joined today, the ST1. So very important that after ruling out bullying, you check about the basic understanding. Means you don't know the level of knowledge at which she has joined. So in the beginning, it's essential to ask that, have you got any idea about breech? Have you gone through the breech delivery options in breech? Then accordingly, you have to explain that when ECV is offered, who offers it, what it consists of, that in ECV, what you do, and if required, you administer muscle relaxants. Okay. And then safety points. Again, patient safety points, don't forget. In ECV, always you have to rule out any contraindications. First, you have to do an ultrasound scan to confirm the breech, pulse, blood pressure, fetal heartbeat, all are to be checked through ultrasound. And then after ECV, again, ultrasound is to be repeated. Baby's heart rate monitoring is very, very essential because sometimes bradycardia may happen and emergency cesarean may be required. And then it's essential that we tell the role player that please counsel the patient that if it is painful, ask them to stop. Then safety of ECV, it is generally very safe, 1 in 200 chance of, however, there is 1 in 200 chance of needing an emergency cesarean section. Success rate is 50% only. Now, another option, come to another option, that if ECV is denied by the patient or is unsuccessful, unsafe for the patient, then the choices remain are vaginal breech birth, which should be done where, done by whom, all those things are to be emphasized. And the last is cesarean section. When cesarean section is to be done, it is essential that you explain to your role player about that. Okay. And also emphasize that yes, vaginal breech birth is risky for the mother, but yes, vaginal, but is safe for the baby. Cesarean section is riskier for the mother, but is safe for the baby. And vaginal breech birth is riskier for the baby. Now here in domain-wise marking, in information gathering, you will be marked on exploring concerns, how much background knowledge you are extracting from the role player or not. Then the focused history about the case, whether you are able to gather information to rule out any contraindications for ECV and for any other modality. Then very important to know patient's views. Always in any station, always take into account the patient's views. So tell your role player about this, that you need to ascertain whether patient is ready for ECV or not, whether patient wants an elective cesarean section or whether she wants vaginal breech birth. You have to teach the role player that it's important to place patient's views as a priority. Then in communication with colleagues, again, the same thing. You should be friendly, rule out bullying and undermining. At the same time, in communication with colleagues, this also comes. Call for consultant or senior opinion when necessary. Pediatrician, anesthetist, midwife, all these should be informed because you might need an emergency cesarean section. Okay. Then other teaching points, you can check understanding, ask to repeat a few points, give information in chunks. Diagrams also you can draw wherever relevant. And at the end, provide learning resources. All these count as communication with colleagues. And then come the most important, patient safety and applied clinical knowledge. Again, it's important that you are systematically explaining the options, explaining the pros and cons of each. You know well about ECV, you know well about vaginal breech birth, you know well where to offer, when to offer, and you know well regarding the safety indications, contraindications, and all those things. Okay. Then support, whether you provide support as pain relief, whether you have asked other specialties also to be involved, like pediatrician, you have alerted the anesthetist, and you have provided PIL to the patient. All these things come in patient safety as well as applied clinical knowledge. Then last task which we are discussing today is task 3. Your consultant, who is the lead colposcopist, is very concerned about the colposcopy referrals from the GPs. He has asked you and your ST1 colleague to audit the referrals. Now this is regarding audit. Now your ST1 doesn't know much about audit, so he asks you to demonstrate how are you going to do it. So here you have to take two things into concern, means two things you have to be cautious about, that you need to explain the components of an audit and apply the principles to your requested task. Sometimes what happens, you keep on telling about audit and you don't apply it to your present scenario. So you have to do both the things. You have to tell about audit also and how you are going to apply it to this current scenario also. Now, how you will do it? So introduction, you will introduce yourself, confirm the agenda, rule out bullying, and again check background knowledge, whether she has or he has participated in an audit before. Make comfortable, invite to ask questions, and reassure that you are going to give articles in the end, and it will be a continuous ongoing learning process. Always start with the definition of audit. Quality improvement process. For all of you out there, audit is quality improvement process. Always start with this definition that is aimed on improvising the patient care and outcomes. And it is done by measuring the current practice against explicit criteria. Okay, and emphasize on this fact that it's not a fault-finding tool, but just a tool for improvisation. Then put stress on the importance of the topic. Then come to audit steps. At the same time, keep an eye on timing also. Okay, time management is very important. You should not stick on one particular aspect. Keep on switching to the next aspects quickly. The first step is to choose the topic, addressing our aims, contact the hospital's audit department, and setting up a team. Then ethical approval is very important. And then deciding for team. Appropriate personnel should be there to conduct the audit. Then next step is to define the standards and criteria. Now, criteria are those of inclusion and exclusion. For example, here, when to refer for colposcopy, this you need to emphasize to your ST1. So for this, you need to have a sound knowledge of NHS cervical screening program. So just brush through this guideline, it's very important. So these are important knowledge-based points regarding referral for colposcopy. So any invasion, high-grade dyskaryosis, glandular neoplasia, borderline changes in endocervical cells must be referred on a 2-week wait pathway. Okay, and at least 93% of people, according to standards, 93% people referred with these results must be offered colposcopy within 2 weeks. Those found not to have cancer on this at the first visit, transfer to 18-week wait pathway for remainder care. Another aspect is low-grade dyskaryosis, borderline changes in squamous cells, persistent HR-HPV positive cytology, and negative or persistent inadequate samples. They are referred with from the starting itself in the 18-week pathway. And at least 99% must be offered a colposcopy appointment within 6 weeks of referral. So these are important knowledge-based points from NHS cervical screening pathway. It's not necessary that you specifically exactly are well aware of these, but yes, don't worry, you should just have an idea. Whatever idea you have, whatever knowledge you are confident of, just deliver that knowledge to your junior. Please don't deliver wrong knowledge at any point of time. Then we have to measure the current practice. Your audit may be prospective or retrospective. This also you can tell difference between these. Here we should collect data retrospectively because it will be easier also and less time consuming also. Prospective may lower the chance of missing data, but definitely it will take time and maybe observation bias. Hawthorne effect is there. Tendency to change behavior when aware of an observer. Then sample size, all those seen by GPs in our district in the last year in whom cervical smears were taken. Then comes data collection pro forma. How will you collect your data? It should be simple and essential data only. Patient identifier, date seen, smear method, result, and action taken. Then when data is there with you, you have to compare the data against standard data. That is data analysis. It may be quantitative. What did we actually do? And qualitative. For those missed, why did this happen? For those over-referred without indication, why? So these will be data analysis done by the audit team. Finally, we have to come out with recommendations. Regular meetings, which may be in the form of regular meetings with the GP to improve awareness using automated notification systems. So after these recommendations, we have to disseminate the results, present the results. It should be in a good graphic format. We should ensure that notification method is like widespread, emails, letters, wherever. Whatever you use, good attendance without a blaming attitude, and so that at last you can agree on an action plan. You have to ensure that changes are implemented. You should agree on measures to monitor, and at last, close the loop by planning a re-audit at a suitable time. Example, 6 months, to see if recommendations were implemented or not, whether there has been an improvement or not. So here in domain-wise marking, communication with colleagues will comprise of how you introduce yourself, how you set the rapport, explain the purpose of the session, how you check the background knowledge and put an agenda, the way you deliver the session, appraise, invite questions, use of drawings whenever appropriate, eye contact, it should be non-judgmental, and ask the colleagues' feedback. Regarding patient safety, few points here are very important, that you emphasize on audit as a quality improvement process, emphasize on ethical approval, setting a good team, and avoid personal blame when presenting results. In applied clinical knowledge, you should know about the steps of audit and how you apply these steps to the current issue. Also, if you have a sound knowledge of NHS cervical screening pathway, it would be a golden addition. And also why prospective, why retrospective, you have to emphasize on these points. So these are the basic points which we have to be very careful about while we are having a teaching station. No matter what, sometimes some stations may be very surprising. You may not have an idea about the station before, but please don't panic. Still, you have got teaching skills in your hand. Still, you have got communication in your hand. Important safety points, you can just try to gather and communicate it to your role player. And still, you can pass the station if you have not got much knowledge about the topic. So do your best, practice a lot. We wish all the very best to you for your exams. Thank you.